Good evening, everyone. Today we are celebrating World IVF Day, a day that helps us do a remarkable potential in the field of science and medicine. So, for many, IVF has been a truly miracle. It has served. It has brought life to the earth. So today we have an expert from the field to discuss on this topic, and she is Dr. Sree Durga. She is an exceptional fertility specialist trained in the trained from the UK with over 22 years of experience, and also she holds a proven track record of success. So welcome, ma'am. Well, it's a pleasure having you here.
Thank you, Lokita. So today is celebrating the day where two intelligent men have slogged through their entire life to get to this stage. I'll tell you a little bit story about those two intelligent, powerful men. These are Professor Robert Edwards and Professor Patrick Steptoe. These are the two men who invented IVF few decades back. So when this was the original idea of Professor Robert Edwards. So when he took this idea, he was conducting animal experiments and he presented his studies in the Royal College. They all laughed out. They thought it was a joke, getting eggs out, mixing with the sperms, and the way lady carrying. Except one man, Professor Steptoe, he thought it's a wonderful idea, so they both struck friendship. And Steptoe is a gynecologist and he's in Oldham, and I'm lucky to work nearby Oldham, the place where IVF was invented. So Steptoe got to spoke to Edwards, and they used to get eggs from the woman, and both of them used to mix them with the sperm. So hundreds of these IVF attempts failed on many patients, but one lady came where they used to take out eggs through a small instrument by putting a tiny cut in the belly button, put a camera, and take the eggs from the ovaries and then mix them with the sperm. That one lady got it stuck. She got pregnant, but the embryo landed up in the wrong place in the tube and ended in ectopic. But the second time, it stuck in the right place, and bingo, the first IVF baby was born on this day 45 years back. That's Louis Brown, and that's what we're celebrating today. And after that, in these 5 decades, exponential change in the IVF techniques, media, drugs, the way we take eggs out. And here we are. The success rate few decades was in single digits, hardly 9 to 10%. Now we are challenging the nature, and our success rate is far beyond the natural success. It's touching even 65 to 70%.
Yeah, ma'am. So our hopes and miracles, we owe it to the doctors that that you have mentioned and you have closely studied on. So also, but in India, we see that like there is a lot of stigma still surrounding around IVF. So what do you think? I mean, a common man should know about IVF, and how is it changing lives, and also specifically, like you have mentioned as a story about what IVF Day is. So if you can also mention about how IVF and what is its success rate, and how can a common man benefit from it, basically.
Well, Alokita, basically, I mean, yeah, today is a World IVF Day, but before coming to IVF, there are many techniques still, which are very closer to nature, which we offer to patients depending upon their diagnosis, like just merely helping their eggs mature, called ovulation induction, and sometimes putting husband's sperm in the uterus, called IUI. We only resort to IVF only if these simple techniques fail, and IVF is the last technique. It's like Brahmastra in the fertility treatments. But sometimes in some women, I had to use a Brahmastra in the first sitting itself. So, so yeah, before it was a taboo, but now, with this improvement in techniques and success, and with the, I don't know, the benefit of using this social media and all, it's no longer a taboo. In fact, you'll be surprised. a million babies, or more than that, we don't have exact statistics, that a million babies are born every year using this technique. So imagine how successful this technique is and how safe this technique is. And yeah, and IVF properly done in a proper unit in a young woman. Sorry, I have to use the word young woman, and it will be coming many times in this short chat with you. The younger the woman, the higher the IVF success rate, or any other success rate, any other fertility treatment like ovulation induction or IUI. It's basically the woman's age that dictates the success.
Right. So, ma'am, I think a lot many listeners offline and online both they have joined, and there are few questions there. So, I'll just,
Sure.
I mean, I would like to ask you so that their query gets resolved. Basically, a question that has come to me is there's a stigma that it is the treatment altogether is very expensive, it's very costly, and it is out of reach of the common man. I mean, the couples who are working. So, is that a stigma, or I mean, is it like what is a cost revolving around the treatment in general?
Uh, the stigma is gone. I've told you last time, the stigma is no longer there, except that, yeah, it depends upon where the IVF, where you're doing IVF. In say, cities like metro cities like Hyderabad, Bangalore, it's no longer a stigma. But maybe if I go to districts, maybe it's a little bit stigma. It's our responsibility as educated persons to to help these people to overcome this stigma. It is just a medical treatment, and you have to use so many exponential the techniques have come in other fields like oncology and all. So why not use it in even fertility medication? So I think even rural medication, rural areas, stigma is gone. And again, cost depends upon whether you are offering this treatment in a rural setup, in an urban setup. It depends, the cost range from city to city, from place to place. But usually, I'll give you a rough figure. It ranges from 1.5 lakhs to 2.5 lakhs in India. Yeah, it can be a little bit more cheaper or a little bit more costly than this. But usually, most of the units try to offer IVF within this price range.
Okay, so I mean, everybody can take advantage of this process then.
Yes, it depends upon unit, city, place.
Yes. Okay. Right. Perfect, ma'am. And also, it's like the success rate is normally people are happy after they have gone through the treatment. That's what the data says. But then also, not everyone needs this in general, right? I mean, there's a certain diagnosis. Some people can take the alternative steps too instead of going for IVF. So, what is your take on that, ma'am?
See, whenever I would say when a couple comes to a fertility clinic, I would say there are a dozen questions. You don't leave the clinic without asking the fertility doctor these questions. First of all, we get the diagnosis mostly from what the woman has told us about her
Okay.
history, her menstrual cycles. Her history gives 50% snapshot of what could be the probable cause delaying their pregnancy. A scan gives me another 20 to 30% snapshot diagnosis, what the woman, confirming the woman's diagnosis. And in additional, we order a test on man called semen analysis. So from the history, from the scan, from the semen analysis, I get 90 to 95% of the diagnosis. What's the condition? This couple are, so unlucky in not getting pregnant. So depending upon the diagnosis, we offer the treatment. Like let's say if the history, let's say you're a patient, and you say, ma'am, I'm having irregular cycles, my cycles are all over the place every 2 months or 3 months. The most common diagnosis for this is a problem called PCOD, polycystic ovarian disease, as common as every third woman in India are even starting from adolescent to menopause, they are suffering through this problem. So irregular cycles, PCOD, if other factors are okay, like her husband's sperm is okay and her tubes are okay, PCOD is a simple. The most simpler treatment is just if you're on the heavier side of the weight, let's just lose weight, and then we just give some hormonal tablets for her to make help her eggs mature. And there's a fair chance for that couple to get pregnant in their cycle. Of course, like I said, any fertility treatment, the success depends upon how young the woman is. Of course, there are other factors also, like the husband's sperm also does matter, but that's the case. So like I said, history, irregular cycles, mostly PCOD. We target on maturing the eggs by giving hormonal supplements, tablets, or injections. Number two, if you tell, ma'am, I'm having painful, horrendously painful and heavy cycles, even my intercourse is painful, that points out towards a condition mostly called as endometriosis. Endometriosis is your menstrual blood flow goes in a reverse way and deposits on ovaries and other organs. So that's endometriosis, but unfortunately, the longer you suffer from endometriosis, it damages your tubes and even the eggs and the ovaries. So if your diagnosis is heavy periods, and I confirm this diagnosis mostly through scan, if not, if the scan suggests something else or I'm not able to make her through scan and she's still complaining of heavy periods, would like to do a small diagnostic intervention called laparoscopy, which again just confirms that this patient probably has endometriosis. So if endometriosis is the cause and it's severe or moderate, you have to go through IVF. But if it's a mild endometriosis, then no need to go through IVF straight away. We can offer some hormonal treatment for few cycles, and if the hormonal treatment fail, we can offer another technique called as intrauterine insemination, what is popularly known as IUI. So these are the steps we go through. We just directly don't jump through IVF. We go to the diagnosis, and depending upon the diagnosis, we offer from simpler techniques closer to natural conception technique to sophisticated techniques like IVF.
Right. So what you're saying is the diagnosis is the very important part of it. So when you're visiting your fertility doctor, you need to ask right questions, and thereby you will reach to a conclusion if you have to go with IVF or not. Is that what it is?
Yes, everybody doesn't need IVF. There are
Okay.
more. There are some techniques, but the good thing with IVF is the time to pregnancy is short. If you have no time, you want to get pregnant very soon because of social stigma or your age or whatever, yes, IVF is the best technique. And its success rate is, I would say, 4 to 5 times compared to the techniques which I just spoke about, the ovulation induction or the IUI. But obviously, IVF involves costlier medication, and because of the financial implications, IVF is not the treatment for everybody, but it is
Yes.
the technique with the highest success rate, that with the time to pregnancy being very short.
Right. Ma'am, just because we are talking about it, there's also a question that has come in. It says that, the cycles, when we go through the treatment cycles are ongoing. So it's not that you have got IVF and then you're done. I mean, there are the cycle you have to go on. You have to frequently visit the doctors, and the medication should be ongoing. So is that the right way?
No, 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 no. See, usually, let's say if any fertility treatment, whether it's ovulation induction or IUI or IVF, it starts with your periods. So the lady typically visits us on the second day or third day of the periods, and we just do a simple scan to see the cycle is good enough for her for us to proceed with treatment or not. So let's say if she has to come through IVF, it involves hardly 4 or 5 visits to the clinic, to so that we just monitor whether I put the right dose for her or not, whether she's responding to the dose I have put, and we might take a couple of blood tests to measure her estrogen levels. So it involves 4 or 5 visits to the clinic, but you need to take injections at least 9 to 11 days for these immature follicles or eggs to grow and become mature eggs. Because more mature eggs, more eggs I get, the odds of finding it 1 or 2 good embryos from those many eggs is more, and the success rate will be more. So typically, if I go to a statistical figure, at least if I get 10 to 12 eggs, there is a very good chance that I'll find a one good embryo out of those eggs and the woman can get pregnant. This is just a statistical model. So in a nutshell, one visit in periods, but every day we train the patients to self inject themselves. And these injections are not, we imagine, those big needles and all. These needles are very tiny, hardly 1 centimeter, no need to go into the muscle, just in your tummy fat. So the lady can self inject. You'll be getting good training directly by our nurses, or we'll give you some videos to train yourself. And hardly 3 to 4 visits for scans in those 9 to 10 days. One visit where we'll be collecting those eggs. You won't be put under no pain because you'll be covering that with a short acting general anesthetic. The procedure hardly lasts for half an hour to max 40 minutes. So we drain the follicles, collect the eggs. Husband gives us a sperm sample that day. We mix with the sperm sample, and then 4 or 5 days later we select the best embryo out of it and transfer that into the woman, and that's a painless procedure. Embryo transfer is a 5 minute entirely painless procedure. And after the embryo transfer, in a 12 days later, basically roughly I would say 2 weeks later, you do the pregnancy test to see the treatment worked or not. And if you made good number of eggs and good number of embryos, the extra embryos, we wouldn't discard them. We freeze them for your future use, maybe for your second pregnancy, if not even for your third pregnancy.
Okay, so the pregnancy that would happen, like the second and the third you have just mentioned, so that would have the chances of conceiving naturally, or I mean, would that be a probability?
It depends upon, in the first place, why you had IVF in this cycle. Was it because your tubes were damaged, or was it because your other conservative fertility treatments like your ovulation induction or IUI have failed multiple times, or was it because of a severe sperm problem? So it depends upon why IVF was done in the first place. Let's say, for example, I have done IVF in your case because the tubes were blocked, and you got pregnant in the very first cycle. But if you go on to get pregnant the next time, and the IVF was offered because of a tubal problem, unfortunately, you have, well, I wouldn't say unfortunately, you have to go through IVF again to get pregnant second time. And the same thing goes for severe male factor as well, and of course, age. So let's say I've offered IVF because you're cross 35 or in your mid 30s. So I would suggest that you needed IVF when you're 35. So you obviously probably would need IVF when you're 36 or 37 and you're coming for your second pregnancy. So it basically depends upon why you needed IVF. But sometimes, like you said, is there any chance of natural conception? Yes, we will be surprised. First time, let's say the diagnosis is unexplained. Unexplained is, well, the doctor or the science can't find any cause. Everything is normal. She's ovulating. She's not that old. Sperm is good. Tubes are good. But unfortunately, the couples didn't get pregnant, and all the conservative fertility treatments have failed. Even those couples would have IVF, and probably they would land up with healthy pregnancy in the first cycle. And these couples have still a decent chance of getting pregnant naturally, if they start trying for the second pregnancy. But like I said, whatever your pregnancy, the younger you are, the younger your egg is, the higher the chances, whether it's natural or through any fertility treatments.
Right. So, so that is a possibility for the second and the third pregnancy. So that is like clear with the explanation you have given, and
Yes.
also maybe a lot of people also would worry that if there are any side effects to the medications people are, going with. So, will there be any side effects? Will that affect the other body parts in any way, like in the long run?
Usually, let's say your ovulation induction for PCOD. We use hardly very low, we start with low dose. So it's very unlikely that the woman would have any side effects with the fertility medication. Mostly what we fear in IVF or other fertility treatments is a condition called overstimulation. We try to controlly stimulate the woman for one egg or multiple eggs in case of IVF, but sometimes, the woman would overreact to this fertility medication and might overstimulate. So this is a condition called hyperstimulation. But now with newly genetically engineered drugs and changing of the drugs and changing the fertility techniques, like freezing the eggs and all, freezing the embryos, and the success rate, hyperstimulation, I would say, has literally come to less than 1%. And the other thing is multiple pregnancy. Usually in IVF I have a control in putting how many embryos I want. If the woman requests for only one embryo and she's young, I would put only one embryo, and therefore she would have a singleton pregnancy. But in some techniques like ovulation induction and IUI, where you have two or three follicles, then there is a chance you would end up with multiple pregnancy. So in IVF also, if I put two embryos, there is a chance of multiple pregnancy. But with newer techniques, we are more slowly moving towards single embryo transfer. So that multiple pregnancy risk has come down to also less than 5% nowadays.
Okay, those were wonderful insights, ma'am. So, on this day, do you have any thoughts that you would like to share with the listeners so that they would, they would be more aware about IVF, and also they would not hesitate in taking this treatment in the future?
Well, I think as a woman, we are the ones, we are multitasking the family as well as the professional life. And because of this multitasking, our childbearing age has been delayed. So I would say, like every condition, you got a master health checkup. For you, if you're a smart woman, start your reproductive health checkup from your early 20s, or at least in your mid 20s, and know how good is your reproductive health. Because now with the advent of techniques, you've got something called a social egg freezing. Let's say you're 25 and your ovarian reserve is poor, you still can freeze your eggs and get pregnant whenever you're ready to get pregnant. So gain your reproductive empowerment, and in a way your empowerment, by regularly checking your reproductive health by simple scan and a blood test called AMH. So this is the advice I would give to a very young woman out there, a young woman out there and a smart woman out there. In fact, I would say from seventh class, girls should be, they should be in programs where they should be enlightened about their reproductive health, so that they can make good choices in life, smart choices.
Yes. So it is very informed session, ma'am, and also for our listeners. I think there's one question I've just been informed. I think it's from yeah, it's from. I mean, the name is not very clear.
It's
So
okay.
they're asking, could you please share what could be the reason for increase in IVF among the younger generation? So that's a question coming from a young lady.
Okay. So, well, your grandmother and my grandmother or got pregnant when they're in their 16s, right? 16s or 18s, where the eggs were very good. The pregnancy chances are very high. But coming to our mothers, the pregnancy age got delayed to 20s. Coming to this generation or the coming generations, obviously the time they're getting married or thinking about their pregnancy, the age is approaching around 30 or mid 30s. And for Indian women, unfortunately, 30 is the cutoff, or early 30s is the cutoff where you are biologically aging, though you're chronologically, you think you're only in your 30s or early 30s. So, number one is delaying your childbearing age. Number two, lifestyle issues. Other, obesity is such a common problem, and therefore it is leading to PCOD problem. Nowadays, I said one in every third lady has got this problem, and other three, and the third one is, because both husband and wife are working, so you're not doing what you're supposed to do. You don't have time to have intercourse when you're fertile and you're supposed to have intercourse. So because of that also, childbearing age is getting delayed. So all this clubbed together, I think that has led to more need for fertility treatments and hence IVF.
Yes, ma'am. Maybe I just crossed a thought that, like you mentioned, because there's a difference. Like in the earlier ages, the pregnancy ages was like 16, 18. Now it's like 30, 35. So is there any lifestyle changes that one can do on a regular basis so that they can do certain things so that they can conceive naturally instead of going for IVF or anything else? So lifestyle changes, or probably meditation or any other thing, would that
Oh,
help?
definitely. Definitely. So most of our women who are PCOD, 70% are on the heavier side of the weight. So
Okay.
simply just lose 10% of your weight. If you're 70 kilos, lose 7 kilos, you see a change in the pattern of your cycle. you start getting periods regularly and therefore egg regularly. So definitely lifestyle changes is going to help you and even the doctor, so that even the simple fertility medication like simple tablets will work on them rather than directly advising them IVF. And obviously, yeah, if reduce your alcohol intake, smoking, all those. And yeah, if you're in a very stressful job, I would advise regular exercise, yoga and meditation, anything that has increased your stress levels and your cortisol levels,
Okay, right.
any technique that can drop your stress levels.
Yes, so that has an impact to the overall
Yeah,
health.
definitely, yes.
Exactly. So, ma'am, another question. I think people are really interested in this conversation now. So they're just asking that whether to go for IUI or IVF in case of PCOD disease.
Well, PCOD is you've got loads of eggs, but none of the eggs is maturing. So
Okay.
So instead of IUI, I would say we use a simple technique called as ovulation induction. So just give
Okay.
tablets, and then when the egg is maturing, have intercourse. We advise IUI only if at least 5 to 6 cycles of your ovulation induction cycles have failed. That is, you're getting an egg, but somehow that egg and sperm union are not happening. So IUI is same thing. We make you have a mature egg and we put highly motile good sperm nearer the egg. So the logic is, as closer the good sperm is to a good egg, the chances are better. So yes, we would try ovulation induction, then only move to IUI if ovulation induction are failed. IVF is a last resort. When ovulation induction or IUI failed, then only we would recommend IVF in PCOD ladies. Unless she has got other problems like husband has low sperm or other thing, where we recommend IVF as a first line. But if it's
Okay.
simple PCOD, I don't think any sensible fertility doctor would recommend IVF as a first line of treatment.
Okay, yeah, that is informative. I hope the listeners would benefit from that information. Also, maybe one last question that all we are discussing is women health, though this has a lot to do with men as well.
Yes, I know
So
where you are coming to. Yes,
yeah,
yes,
so
yes.
any advice for men, ma'am?
Like whatever advice I give to women, the
Yeah,
same advice goes to a man. If
man as
50, if
well.
Yes, if 50%, if a woman is responsible to get a healthy baby, 50% comes from the sperm, that is the man. So if you're on the heavier side, lose weight. If you're smoking and drinking, please stop it. If you're in a highly stressful job, go and reduce your stress levels, yoga, meditation, or whatever. And like a woman is getting checked, like I said, reproductive health through scans or blood test, I would say the man, go and get your sperm test occasionally, at least know your problem initially. So, whatever the advice a woman I have given to the woman, same advice goes to the man as well.
Okay, so listeners, that's for men as well as for women. So that is Dr. Sree Durga. She's an exceptional fertility specialist and she's trained in the UK with over 22 years of experience, and also she has a proven track record of success. So I would advise all of you to visit her in case if you want any consultation, and also we will definitely join you for more sessions.
Yes.
Thank you so
So
much.
thank you, Alokita, and thank you, audiences, for putting up with all the questions. So if you got any burning questions, yeah, you got phone number, do ring the number. We are more than happy to receive your queries and I'll answer you back. Thank you.
Yeah. Thank you so much.
Thank you.